Thanks for giving me the opportunities to share our research findings, acceptability of self-sampling for HIV/STI testing in MSM. I have no conflicts of interest to declare. HIV and STI are correlated as they share a common mode of transmission. STI could be a marker for unprotected sexual intercourse and can increase the risk of HIV infections by up to 10-fold. Therefore, regular HIV/STI testing in MSM is recommended for promoting HIV/STI prevention and enabling timely treatment. This has been recommended in guidelines in Australia and also the US CDC. To boost up the testing rate, a meta-analysis has summarized that self-collections of samples could increase the uptake of STI testing service, especially amongst the male participants, and they concluded that self-collection of STI samples could be an effective additional strategy to increase STI testing uptake. Therefore, in this study, we hypothesized that self-sampling may increase the uptake of testing on a regular basis, and we aim to assess the acceptability of this process in MSM. This is a one-year cohort study in Hong Kong. Participants were asked to test for HIV/STI at 3 monthly intervals, and at each visit, they were asked to self-collect their urine, pharyngeal, and also rectal swabs for CT/NG test. While blood samples would be collected through either blood taking or with the assistance of research staff, participants they self-collected their finger prick samples for syphilis POC test and also the driver spots for HIV test in the laboratory. We have set up an online system for this study. In the system, participants could make appointments online. And they come to the research center for the blood sampling for syphilis and also HIV test, and also self-collections of urine, pharyngeal, and rectal swab for the CT and NG test. The test results will be uploaded to the system once ready and will be made available for checking by the participants in the system after login. So these are the urine and also swab collection kits and also the materials for the driver spot care and also syphilis rapid test. In each month, an email reminder is automatically sent to the participants to complete a survey. And besides updating their sexual behavior in the past 1 month, if they had come for follow-up visits in the past 1 month, they will also answer the questions related to their perceptions of the self-sampling process, scoring between 1, strongly disagree, to 10, strongly agree, in terms of convenience, level of discomfort, confidence, and also accuracy. And also, the test results will be stored in an Excel file as well. The correlation between perception items and also time were examined. Between 2019 and 2020, we recruited 206 MSM. Most of them are local, highly educated, and reported relatively high monthly income level. 41% reported ever had chemsex engagements at baseline, and of which 66% reported chemsex engagements in the past 1 month. The proportions of samples satisfactorily collected by self-sampling for laboratory testing was very high, more than 99%. And the proportions of tests positive for NG was the highest amongst pharyngeal swab, and the proportions of positive CT was the highest amongst the rectal swab. The correlations amongst the perception items was significant amongst each other. However, it was not significantly correlated with time points. That is, the numbers of times of self-sampling collections was not correlated with their perception. The proportions of pharyngeal swabs with equivocal results or inadequate samples for NG in this study was lower than a previous study in Australia. And a qualitative study recruiting 75 MSM for self-sampling for anal rectal STI and followed by an in-depth interview, they summarized that self-sampling proved to be a feasible and acceptable method for collection of anal rectal STI specimens, which is consistent with our study findings. To conclude, self-sampling for HIV/STI testing is feasible and generally acceptable, and despite discomforts during self-sampling, other perception items, including convenience, confidence, and also accuracy, were high. Their perception was supported by the high proportions of satisfactorily collected samples. And here are the research team members, and this study is supported by the Council for the Aegis Fund. And we would like to thank the LIHS for the technical support and the support from the Hong Kong Society for HIV Medicine for the registration of the conference. That's the end of this presentation. Thank you.